The Leading Safe Choices initiative promotes best practices in family planning and abortion care. This film is about best practice in providing abortion counseling. Tembi and Angelina are going to role play an abortion consultation.
Hello, Angelina.
Hello, sister.
I am Sister Tembi.
It's nice to meet you, Sister Tembi. The first step is to greet the patient. You should introduce yourself and check the patient's details. You should then explain the purpose and confidentiality of the consultation to the patient.
I am pleased to meet you. Just confirm, is this your name, address, and date of birth?
Yes, it is.
Okay, that's fine. How can I help you today?
Sister, I think I might be about 9 weeks pregnant, but I'm not really ready to cope with the baby at the moment.
Okay.
So I would really like to request an abortion.
Okay. I would like to remind you that everything we discuss in this clinic is confidential. I'll ask you a few questions about your general health, and then we will discuss what options we have for your request.
Okay, thank you, sister. Ask the patient how you can help them. Take a detailed history of this pregnancy as well as a gynecological history and ask about any previous pregnancies. You should ask the patient about their medical history, including any operations they have had, any medication they might be taking, and about any allergies they have.
I see my colleagues have already confirmed your pregnancy. When was the last period?
It was about the end of May.
Okay. And since that time, have you experienced any bleeding or any pain at all in your tummy?
No bleeding at all, but then I've just been feeling a bit sick, nauseous, and then my breasts are very tender.
All right. That's usually the signs of pregnancy. Have you been pregnant before?
No, I haven't been pregnant before because I haven't been with my boyfriend for very long. This is the first time I become pregnant, but it was unplanned.
Have you used any contraception, doctor?
I did use the pill for a couple of months, but they made me very sick, so I stopped. And then we also tried using the condom, but we forgot, and that's how I got pregnant this time.
I see that the condoms didn't work for you, but the condoms are useful for preventing infections. Have you ever been found to have a sexually transmitted infection?
No, sister.
Okay. Were your periods normal before you got pregnant?
Yeah, they were quite regular, sister.
They were regular.
You should ask about the patient's social history and ask about possible gender-based violence. You should check that she's certain about her decision to have an abortion.
Angeline, you did mention a boyfriend. Can you tell me a little bit about him? How old is he?
He's 18 and his name is Sixmont. And he works in a band at the moment, but he doesn't earn very much money, and that's why we're not really able to cope with the baby just now.
So he's still living at home with his parents?
He is living at home with his parents.
Okay. Do you have any other partner yourself?
No, I don't.
Do you know if he has any other partners?
He doesn't have any other partners, but he did have a girlfriend before me.
Okay. Angelina, we always ask this question of everybody. Have you ever felt threatened or be afraid that your boyfriend will hurt you?
Not really, no. We get on very well.
Oh, that's lovely. Have you told him about the pregnancy?
I have told him about the pregnancy, and he agrees with me that we're not ready, so he feels that we should end it.
And have you told anyone in your family about the pregnancy?
I live with my parents and my 2 sisters, and I haven't told any of them because if I tell my parents, they'll probably throw me out. And if they throw me out, I can't live with Sixmont because he doesn't earn very much.
Now, I need to ask you about your general health. Have you had any operations?
No, sister.
Any medical problems?
No.
Are you taking any medicines at the moment?
No, I only take like paracetamol if I have a headache or I'm in pain, but no other medication.
Do you smoke at all?
No.
Have you taken any street drugs?
No, sister.
Okay. I would like you to lie down on the couch. I would like to examine you and find out how far you are with this pregnancy.
Okay.
Hello.
The clinical examination assesses gestational age and looks for any evidence of complications of early pregnancy, infection, or other problems. Thank you.
Okay, Angelina, I have examined you and I found that you are 9 weeks pregnant, which corresponds with your dates. Now we would like to discuss the options which we have for the abortion.
Okay, sister. You should explain the different abortion methods available to the patient and offer her a choice about which method she'd prefer. Once the patient has chosen a method, you should explain what will happen to her in detail before ensuring that she has given informed consent for the procedure to go ahead.
There are 2 options. There is the medical option where you take tablets here and you take some more tablets after 48 hours. Bleeding will start thereafter, which may be heavy initially, but it settles and you may have spotting for up to 2 weeks. It just feels like having a miscarriage at home. The other option is the surgical option, which is called manual vacuum aspiration, short MVA. That is the one which we do here in clinic. It's a short one, takes about 10 minutes. It is a bit uncomfortable, but it is bearable. And you may have to rest in the clinic for up to an hour.
Okay.
Do you have any questions?
Not at the moment, no.
Do you think you have decided which one you would like to have?
I think I'll have the surgical one, the one that you do here. Did you call it the MVA?
Yes, that is the MVA.
Okay, yeah, because I think that one, it gets done over and done with very quickly. And also because I'm living at home, I don't want to be bleeding for a long time.
Angeline, shall I explain to you the procedure of what will happen on Friday? Okay. Please come to the clinic at 8 o'clock. And when you come into the clinic, we will do an internal and introduce a speculum in order to inject and numb with a local anesthetic the opening of the womb. All right, Angeline, I've explained what will happen on Friday when you come in for your MVA. Are you certain you want to go ahead with the MVA?
Yes, sister, I'm sure.
Okay, in that case, I would like you to sign the consent. This explains what I've already explained to you. Would you be able to sign down here for me?
Sure.
Thank you very much.
The final step is to discuss with the patient what method of family planning will be used after the abortion by following the gather approach for a family planning counseling.
Now, Angelina, let's talk about a more reliable method of contraception which you could use after the MVA, after the abortion.
Okay? Yes, sister, that would be helpful.
Yes. Now that we have decided on the method of contraception which you would like to have after the MVA on Friday, do you have any other questions?
No, sister. So I'm going to come in on Friday, and then I'm going to have the MVA, and then I'm going to have the IUCD put in afterwards.
Yes, you will. Okay.
All right.
All right. That's fine. Thank you very much.
Thank you, sister.
Thank you.
I'll
See you
on
Friday.
Friday, yes. Thank you. Bye-bye.
Bye-bye.